Before I finish and we go to the panel, I just want to make sure I thank Annette Fetchko for coming, my supervisor from the Center for Inclusion Health, and we also have one of our residents here as well. So I just want to thank you for being here today. So that's all I have as far as the remarks that I wanted to mention. So now I would like to invite the panelists to come. We have Wasi Mohammed from the Islamic Center of Pittsburgh. Please come forward. We have right here Ivania from the Latino Community Center. And last but not least, Benedict Pilan from Allegheny County Health Department. Alright, so thank you so much for agreeing to be part of the panel. And they will tell us more about themselves and what they do, so that's why I didn't get into that. Again, so we have a really good team of people. I know all of them. I've worked with them for many years in their organizations. So I think we're very lucky to have them. So first, we can just go we can start from Benedict and go to Wasi. If you can just tell us about yourself, and what you do, and how you got to do the work that you're doing, and also if you can also mention where you're originally from. Thanks.
Hello everyone. Hello everyone. As Carol mentioned earlier on, my name is Benedict Keenan, originally from South Sudan. Right now, I work at the Allegheny County Department of Human Services, the Office of Immigrants and Internationals. Basically, what we do at the county level is to make sure the services of the county is able to reach all the immigrants and internationals in the county. And also, we have to integrate the services that we have to the needs of the immigrants in the county. Secondly, thirdly, the office also, we have contracts. We contract with non-profit organizations so that they are able to go out there and also work with immigrants. So what we, at the county level, what we do is to make sure that those non-profit organizations or those organizations are doing what we ask them to do. So, and then on the other side of it, also from the community level, I am very much involved with the African community, and right now I am the president of the Union of African Communities in Southwestern PA. So, the Union of African Communities is the umbrella association of all the African communities in Southwestern PA. So basically when we talk of communities here, when I talk of communities here, I talk basically of countries. So we have over 15 to 20 African communities, and these are African countries, and they are all well organized.
Thank you, Benefit. Ivana, just a question.
Hello everyone. My name is Vivian Ivania Rivas. I'm from El Salvador. I came to Pittsburgh around a year and a half ago. And when I came here, I moved with my 2 children. And I have experience working in non-profit with people in needs in my country for about 20 years. So I started looking support to understand how to find a job here. So I started with a workshop, was led by All for Alls, the GPLC, and the Career Development Center. This was a workshop for workforce immigrant development, and they taught me how to navigate the professional system here. So 5 months later, I applied for different jobs, and I was hired by the Latino Community Center. So I'm working there as a community engagement coordinator. And for me, it's a pleasure to be here.
Thank you again. Wasi?
Hi everyone, Assalamu alaikum, Eid Mubarak to everyone, especially those practicing and observing. My name is Wasi Muhammad. I'm the Executive Director of the Islamic Center of Pittsburgh. I've been in that position since 2015. The 2 years before 2015, 2013 and 14, I served as the Director of the Islamic Center of Pittsburgh's Food Pantry Program. So that's actually how I started working with the Islamic Center and seeing all the different needs of the community and what we needed to do. And then after 2 years of that, they offered me the job of Executive Director, and we've expanded the pantry since and worked on a lot of different programs that help to expand the social safety net that exists for the people at the center. And it's been a fascinating experience. At the Islamic Center on Fridays, we have around 700 people who come to our Jummah prayer, our congregational weekly prayer, and of those people, we've hit over 50 nationalities so far that we've counted. And it's very complicated to work with a very, very diverse community. Usually when people hear Muslim, they assume Arab, like I said, but in reality it's extremely diverse, over 30 languages spoken, lots of people from lots of different areas, different group sizes, whether you just came over, how you came over, and how many generations in you are really also adds diversity to the community. So navigating that has been a really interesting experience, and so that's the role I've been in the last couple of years, and leave some rest for the rest of the questions.
Thank you very much, everyone. And so as you already mentioned, you guys mentioned a little bit about the communities that you serve. Benedict, through your work at DHS with various type of community, and with the USC, Union of African Communities, and Vivian with the Latino community, and even you can even talk specifically about your own participant, the Latino Community Center, and Wasi, the Islamic community. So if you guys can do the same, and we can start this way this time, and if you can tell us more about, just give us a snapshot about the people that you work with in your community, that you serve, just to give us an idea what the kind of work you do and the people that you serve.
Perfect. So at the center, like I mentioned, there's a lot of people from a lot of different places. And it becomes very complicated to work with. For example, we do have a significant refugee population. We've met people from Iraq and Syria and Somalia and several other countries, and other people, asylum seekers from Yemen, and we have other people who just immigrate over, like a lot of the South Asian, we have like Indian, Bangladeshi, Pakistani populations are pretty significant. They had a different path to get here, right? So one of the biggest things to note is not monolithic at all. And especially when you're talking about health, these populations are very different, right? We're also well represented within the healthcare field. It is particular cultural groups that take the largest percentage, but I think that the numbers are that we're 1% of the American population, but 10% of the physicians, in the country, which is very large. And there's a strong emphasis on healthcare in terms of pursuing that as a career. But public health and a lot of other things are that's very difficult. So what I've found is that each different cultural group, depending on that group, it really changes what they're going through, what their needs are. Do they have trouble accessing healthcare, or is it mainly like lifestyle choices, right? Like for example, diabetes in the South Asian population is a big issue, and we see that, and we want to help that, and like we would love to do some more programming around that. So we notice that as a problem, right? However, they do not have the language access issues. Typically they're fine, whenever they go and try to engage with the system. All in all, most of them are okay, and they have access to people who are bilingual very easily, if not, right? So as opposed to some other populations that we've worked with that completely have the language barrier issues and do not go to clinics, do not go to services because they just assume they cannot communicate. And they've had too many experiences like that before, so they don't. So the biggest issue that we deal with is actually just learning about the different populations and kind of working with them where they're at, and then getting to know the leadership of each different cultural group. That's because that's really important. Is that helpful? Does that make sense?
Yeah.
I will say almost about the same. I mean, we're working with the Latino population, but even though we can call them Latino, we have different, but it's a variety of cultures. We have different level of Latino people who come here with visa, work visa, student visa, and people who just decide to cross the border between Mexico and the United States. So we have different, we're working with different groups of Latinos, and in some cases it's harder, most with people that is undocumented. We're trying to focus with this target group because there are the people who is most in need for us. So it's harder to help them because they have less resources, available. There are less resources available for them, but those are the target group we have decided to work with. So we are working in different programs as a Latino Community Center, trying to connect this target group with different services. But for example, we have people who comes from Puerto Rico. They're Americans, but they don't speak English. So that's a big barrier for them in order to find a job, and we have people that they're just immigrate, they're young people that their English level is very low, so they are going to school, they're going to the college, but